I'm Danica. I'm excited to share a little bit about my experience working on an interprofessional team as part of this class assignment. And I want to share what I've learned about what it takes to have a good collaborative and interprofessional team experience. So to first introduce, I think I'll give you a background of my interprofessional experience. I chose to work with a local Ethiopian business called Sagan Multimedia and Promotion, and specifically working on one of their newer projects with the International Cardiovascular Medical Center, or ICMC. It's a hospital here based in the capital city of Ethiopia, Addis Ababa. And so after approaching Sagan to volunteer, they specifically delegated me to work on that ICMC project. The ICMC project, what it does, or what they're doing, is developing a digital notice board for patients as they come into the hospital to really give them more health awareness insights, and also to touch on a little bit of the logistics of when doctors are available, timing of appointments, etc. So where they wanted support from me is to develop content on two specific health-related topics. Number one, vaccines. Number two, communicable disease. So I collaborated with two medical doctors, two IT specialists or information technology specialists, and of course there was a representative from Sagan, the business, as well. So over 3 days we collaborated to develop content on the two topics, really to encourage patients already in the hospital to seek out, again, these additional health services and learn more about them as well. So to answer the question of what makes a good interprofessional service member for public health, I want to touch on three main points. Number one, professionalism. Number two, respect. And number three, having a strong command of the subject matter while also being able to listen and learn. So number one, professionalism is a pretty basic concept, potentially obvious, but it has so many layers and is so important and it impacts so much that I didn't want to skip it. Starting from the way we present ourselves, whether it's how you dress, the way you shake hands, the way you make eye contact, smile, or the words you choose. We're making a first impression. Ensuring that we are professional is a basic skill that can be refined as we grow professionally and socially. But thinking of this idea of professionalism, what it means, what it looks like, what it, practical, tangible ways to be more professional, having a grasp of those is really that first foot in the door in many professional and social environments. So when I met with the doctors and IT specialists and business representative, I tried to dress and speak and, of course, act the part of a professional, right, in public health. So from the positive feedback and interactions that I had, I believe that enabled an environment of respect from the get-go that then I could build upon throughout the different meetings and build upon with the points that I'll talk about here coming up. So the second point that I want to talk about is respect. Respect of others' professions and insight is critical, especially when dealing with teams from other areas of expertise. So an example where I learned this a little bit too late was when I automatically focused my attention on what the medical doctors were saying in terms of their insight and their ideas for the content development, that with the first draft, I completely based my content development on what they had presented me with, and then I took that and took it to the IT specialist and was like, here you go, this is ready somewhat to kind of develop into some sort of design for the notice board. And they were like, well, that's not going to work, it's a little too long, and so you need to shorten it down and kind of start from scratch. And so I learned that I really needed to respect, in this case, respect each and every aspect of the interprofessional team, no matter what, level of education it required or what have you, but respect each and every part of it equally, because if I didn't, it would not effectively utilize the time and the effort of everyone on the team. So respecting others' insights and their professions is critical. Finally, making sure that I had a strong command of the subject matter, and also being willing to listen and learn proved also to be a valuable trait. Prior to meeting with the team, I prepared myself by studying the information and data that is already available on contextual factors, vaccines, and the prioritized communicable diseases. So I looked at studies related to perception of care in Ethiopia, vaccine uptake rates, rates of disease, and related information about these aspects specific to Ethiopian context. And in that way, I was then able to come to the meetings with a common understanding, a basic understanding, and even during the conversations add valuable insight. And the second part of that third point is being willing to listen and learn, even though you have a strong command of the subject matter. So I was able to hear what they had to say. Obviously, I wasn't a complete expert. You need a little bit of humility and openness to be able to hear others' insights and build upon what you know, and maybe even change a little bit of your perspective as well. So thank you for taking the time to watch this presentation. I hope those 3 points were relevant and related to your experience as well. And I look forward to hearing your feedback on ensuring professionalism, respect, and having a solid command of the subject matter while still being willing to listen and learn. Thanks again. Bye.